Hello, everyone. Welcome to today's presentation, New Screening and Brief Intervention Simulations for Health Professionals. I'm Maria Noesi from Kognito, and I will be your moderator today. Thank you again for making time for us to be with us. Before we get started, I'd like to go over a quick housekeeping. First, the presentation will be recorded, and a copy of the recording and the slides will be sent to you after the presentation. Second, attendees are in listen-only mode throughout the session. We do welcome your questions, so on the right-hand side of your screen, there's an interface where you can type in your questions. I will be monitoring them, and at the end, we have a Q&A sessions where we can answer all of your questions. Without further ado, I'd like to introduce our speaker. Cyril Adam is the Senior Director for Health Programs, and for 3 years, he has led the development of Kognito simulations on substance use, some of which you'll see today. Cyril holds a Master of Education from Teachers College at Columbia University and is currently working towards his doctorate in learning technologies and instructional design. He has previously worked on health and technology projects for the Columbia Center for New Media, Teaching and Learning, and the United Nations Children's Fund. With that, I'd like to hand it over to Cyril to begin our presentation.
Thanks so much, Maria. Welcome, everyone. It's a pleasure to have you all on this webinar and to launch 2 new Kognito simulations today. So just to briefly go over the agenda for today's presentation, we will first talk about why screening and brief intervention are important practices for health professionals today. We will then go over challenges and solutions in workforce education, in teaching, screening, and brief intervention competencies. And we will then show you an overview and a demo of SBI with adolescents. And we will then follow up with a brief overview of SBI skills assessment, the second simulation we're launching this week. And as Maria said, we will then have time for questions and answers. So let's get started. Why screening and brief intervention? Substance use, as you probably all know, is a major public health issue facing our society today. Alcohol is responsible for a host of acute and chronic conditions, and the access to care is also a big problem. Only 14% of young adults who disclosed drinking alcohol were asked about alcohol use by their doctor. In addition, traditionally, we have been very focused on substance use disorders, yet most people who drink too much aren't alcoholics. 29% of the population meets the criteria, yet 90% of them aren't dependent on alcohol. And of course, this is not just alcohol, but can be applied to a range of substances such as marijuana or prescription medication abuse. Opioid has certainly been in the news recently. And finally, a brief intervention is effective in reducing consumption. Brief interventions are short conversations which typically include communication skills like motivational interviewing that can really help motivate patients and clients to address their substance use. Now, preparing the next workforce to conduct screening and brief intervention with their patients and clients is a challenge. There is very promising evidence to support the implementation of SBI in a variety of settings where it's already being implemented in primary care, college campuses, school-based health centers, emergency departments, or community settings. And yet, adoption has been slow among professionals. Less than 50% of AAP-affiliated pediatricians regularly screen adolescents, and we hear from many providers that they are short on time and on training and on treatment resources to really address these issues effectively. Finally, education on substance use is often optional or specialized. It is something that is taught in mental health courses or other courses for specialized professionals, but it's not part of the overall base education for most health professionals. And as I mentioned, this education is often geared towards substance use disorders or addiction, yet we have a real opportunity to catch excessive substance use as soon as it appears and to prevent the development of those disorders. So this leads us into a collaboration that we entered into with NORC at the University of Chicago to integrate substance use education in health professions. And the first goal of NORC in order to do that was to engage the main stakeholders in a learning collaborative. So NORC, with the generous support of the Conrad M. Hilton Foundation, has engaged the accrediting bodies and professional associations, such as the American Association of Colleges of Nursing, the Council on Social Work Education, and the Center for Clinical Social Work, to engage them, as well as leading experts and researchers and over 70 schools of social work and nursing, who all participated in this learning collaborative and contributed to the development of the deliverables as part of this project. And the first was for NORC to develop an adolescent SBIRT curriculum and an instructor's toolkit, which they just released earlier this week. And I really encourage you to reach out to NORC if you would like to access this. And the goal here is to develop, implement, and evaluate an adolescent SBIRT curriculum, as well as develop and disseminate the instructor's toolkit, as I mentioned. And finally, the third goal was to develop and implement Kognito virtual patient simulation, which we'll show you today. This simulation aims to offer deliberate practice in screening and brief intervention. It provides a scalable and standardized training and assessment solution, as we'll see. And finally, NORC provided stipends to schools to implement and evaluate the simulation's effectiveness as part of a randomized control trial. So why did they come to Kognito? We believe this was a perfect fit because Kognito believes in the power of conversation to inspire, inform, and change how people think and act. And yet the most important conversations are usually the most difficult. We often feel unprepared to have them. So if you think about the last time a friend of yours might have come to you for help, you feel that it is important to help them. You want to help them, and yet you may feel a lack of skill or confidence in having that conversation effectively. And so Kognito creates digital experiences that prepare people for the conversations that matter most. And we do this through digital simulations, such as the ones that you can see on the right of your screen here. And these digital simulations allow individuals to enter a digital environment where they take on the role of, for example, a healthcare provider here at the top, or a mother here at the bottom, and can practice engaging in a conversation with virtual characters who will then react just like real people would. And that will enable those people practicing those conversations to learn through trial and error how to have those conversations. I also wanted to mention that Kognito is the only company with digital simulations listed on the National Registry of Evidence-Based Programs and Practices. Research is very important to us, and we continuously evaluate and improve these simulations. We are often asked, why do we use virtual humans in these simulations? There has been a lot of research to support the use of virtual humans over, for example, video characters. Part of that is that virtual humans help create a barrier with the real world, what we call the magic circle in instructional design. We let people enter an environment with its own rules, which is still consistent with the environment in which they practice, you know, a hospital or a school setting. And having interactions with those virtual humans, people feel much more comfortable because they know that they are not at risk of harming a real person. That person that they are speaking with is not going to have any negative consequences because it's a virtual character. And therefore, that enables the learner to really experiment with a variety of effective and ineffective tactics. Virtual humans also help engage learners, especially some of the health profession students that we serve with these simulations, are much better engaged with this format. They are used to playing video games. There is a decrease in transference reaction. These characters are less likely to remind you of somebody you knew in the past and that you may not have liked very much. There is something a little more neutral and yet very expressive about these characters. And finally, the virtual humans allow us to really personalize the experience. So for example, in SBI with adolescents, as we'll show you, learners are able to play as either a nurse or a social worker. So again, a great feature of this technology. The methodology through which we develop these simulations is based on neuroscience, social cognition, and adult learning theory. For example, it is very important for us to give a lot of control to the learner. And let me use an example here. When all of us learn to ride a bike, as I'm sure most of us know how to, we didn't simply learn to ride a bike by watching a YouTube video or clicking through a PowerPoint presentation. We learn to ride a bike through deliberate practice over time, a very important concept in education. And typically that is done with some scaffolding, with the help of some support like training wheels. You would usually have a coach who would help you, who typically would be a parent, who gives you feedback on how well you're doing. And over time, through this deliberate practice and trial and error, you will be able to refine your skills and eventually take away the training wheels and really go for it and put yourself in the situation where you can actually apply what you've been learning and practicing. And so in this simulation, in this first simulation that we want to talk about, SBI with adolescents, the goal was to create and implement an adolescent SBI simulation for health professionals and students to really be able to gain that deliberate practice in having those conversations. And so in the simulation, they are able to first learn to screen adolescents using validated tools. They will then apply a brief intervention model, which is a conversation structure that has been shown to be effective in driving improvements in behavior, as well as motivational interviewing, a set of collaborative communication techniques that have been shown to be very effective in driving positive health behaviors. They will learn to make collaborative action plans with patients, and finally to provide treatment referrals while coordinating care. And in this simulation, as you'll see, learners will speak with 3 adolescents, and in the last conversation, we will be able to take off the training wheels and assess their skills. So without further ado, I'd like to show you a brief demo of this simulation. Please just keep in mind that because we are playing this over the web with many people attending, there may be a little lag in the quality of the simulation. Please be assured that this is just due to the online format, and after this presentation, we will send you a link where you'll be able to access the simulation and experience it fully on your own computer. Okay, so let's see what it looks like. As a brief setup, Josh came into the ER with an ankle injury, and so once his ankle injury is taken care of, you as the nurse or social worker will be able to have a conversation with him about the role that his substance use may have played in his injury. So let's see how the conversation goes.
Hi, Josh. I'm the social worker that Nurse Slope has mentioned.
Yeah.
How are you feeling?
Well, I've been better.
I'm sorry to hear that. Mind chatting with me while we wait for your x-rays?
I don't know. I'm pretty slammed today.
So, yes, you can talk?
Yeah, sure.
Okay, so after this brief setup, the coach informs us that our first goal is going to be to build rapport with our patient or client.
So just to help me get to know you a little better, what kinds of things do you like to do for fun?
Well, you know, there's like nothing to do in this town. I hang out with my friends.
What kinds of things do you do when you hang out?
We chill, play video games or whatever, some pick up football.
You like to play video games and football with your friends? Are you on the school team?
Yeah. Next year I should go varsity.
All right, so here we've modeled how to start the conversation in a way and do a little bit of chit-chat. And you can see at the bottom a pop-up window comes up to tell us that our first goal is to build rapport with Josh by asking about his life and getting to know him, asking for permission to raise the subject of substance use, and finally to discuss Josh's substance use. Just want to show you a few features of this interface. You will talk with Josh by using this button in the top left corner, which reveals a variety of techniques that you can employ, which are going to be effective or neutral or ineffective in engaging Josh in this conversation. And these choices represent a range of, as I said, effective and ineffective tactics that we developed with our subject matter experts, a wide range of subject matter experts, including from the professional associations that we mentioned, who helped inform these choices by telling us, well, what are common mistakes that practitioners make, and what are the desired behaviors? What do we want them to say? A couple of other features in this interface. At the bottom, you'll be able to bring up the brief intervention checklist at any point and to remind yourselves of your goals in this section of the conversation. And you will also have access to Josh's engagement meter, which you will see change throughout the conversation and which will show you just how engaged Josh is and how ready and trustful he is in having this conversation with you. So let's see how it looks and talk with Josh. I'd like to start with a common mistake that practitioners make, which is to jump into giving advice to patients. So let's tell Josh, well, drinking is a little bit dangerous for someone your age. Let's see how you might respond to that.
On the form you filled out, you said you regularly drink.
Here comes the lecture in 3, 2, 1.
I don't want to lecture you. It's just really dangerous for someone your age. I mean, look at what happened today.
Oh my God, you're right. It'll never happen again. I'm so glad you were here to set me straight.
So as you can see, we jumped a little quickly into giving Josh advice, and he didn't respond so well. And you can see that these characters are very realistic in terms of their character. So here the coach is inviting us to undo our choice and to go back and try something else. So let's try. And this time, I'd like to use a little more collaboration in speaking with Josh and maybe ask about his life a little bit before we talk about his substance use. So let's ask him just how he ended up injuring himself.
Seems like you had kind of an interesting night. How did you end up on the roof?
I already told the lady at the desk. Doesn't your former would ever have that?
Well, I'd like to hear it from you.
We were hanging out at a friend's place partying, and some of us got in the hot tub. And I thought it would be cool to, you know, if I could jump in from really high.
Okay. And when you say partying, what do you mean?
You know, drinking a few beers and having some fun.
Okay, so we asked Josh an open-ended question about his night, and we saw that he was really much more willing to talk with us here. So let's continue and maybe start addressing different questions with Josh. So let's raise the subject of substance use. And again, there are two ways you can do that. You can ask for permission and say, may I talk with you about this? Or you can say, we need to talk about this. So let's choose the second option and see how you might respond.
I saw your answers to the substance use questionnaire about alcohol and drugs, and we need to have a talk about it.
Here it comes.
And we see that that was ineffective. Saying we need to talk really was a little too directive. So again, we are invited to undo our choice. And you can see that this undo button is always in the top left corner. Again, we want to really encourage students to experiment with a variety of techniques rather than always focusing on saying the right thing. So they'll be able to really experiment and undo their choice when they see that it was ineffective. So let's ask him a little more about tonight's party before we go back to asking him about substance use.
Tell me more about the party tonight. What were you doing before you hurt your ankle?
You know, drinking and goofing around.
How much did you have to drink tonight?
A six-pack?
How typical is that for you to have 6 drinks?
Well, I guess tonight we partied pretty hard. We won our football game on Friday. The team usually parties together after a game, and when we win, that makes it even better.
Were you using anything else at the party? Any other drugs?
Nah, it's just drinking.
Okay, so he seems much more willing now to talk with us, so we'll be able to probe a little further and talk about the alcohol screening form that he filled out.
I noticed you filled out the questionnaire about alcohol and other drug use. We ask all of our patients to complete that. Thank you for being honest on it. I'd like to talk with you for a few minutes about your responses. What do you think about that?
Oh, okay, I guess.
And here a really cool feature, as you can see, we can actually listen to what Josh is thinking. So let's see what that sounds like.
I didn't think anyone would look at that thing. Maybe I shouldn't have been so honest.
And so on one hand, Josh told us that, he is very willing to talk about alcohol and revealed quite a lot about his night. And yet when we brought up the screening form, he raises some concerns about privacy, which is an issue that learners will be asked to address with those virtual patients at several points in the conversation. A very, very big issue when speaking with adolescents. So let's try and get a little more information from Josh about how he views the role of alcohol in his accident. And we can ask 2 different questions. You can see at the top, we can just ask him, what role did alcohol play in your injury? And the second choice here, have you ever gotten into a car with someone who's been drinking? You probably recognized as one of the questions from the CRAFT screening tool for adolescents. So let's ask him about the role of alcohol.
So how does alcohol factor into the accident tonight, if at all?
I figured you were going to ask that. Look, am I going to get in trouble for writing that stuff on the form? Or for telling you any of this stuff?
Everything you tell me will be confidential, unless I hear that you're harming yourself or someone else, or you tell me that you've been a victim of abuse. I'll keep our conversation about your alcohol use between us, unless you agree to include your parents.
Okay. Well, I was drinking a lot, so I guess you could say it was a factor.
And here the coach is reminding us again that confidentiality laws vary, so to be sure to address that in a way that is consistent with the local laws where the practitioner is working. So let's ask Josh a little more about the party, and we can again ask the question about getting into a car with someone who has been drinking, or we can ask Josh about how his parents feel about what happened tonight, or we can continue talking about his alcohol use. So let's ask him a little bit about that.
So your questionnaire says you drink alcohol every week. About how many days a week do you drink?
Once, maybe twice a week, just at parties.
You never drink outside of a party?
Yeah, there's no point, really.
And how long have you been going to parties where there was alcohol?
I guess since the beginning of the year. Well, the guys throw parties every weekend.
Okay, so Josh at this point seems really open to having this conversation with us. We've done a really good job, and we've in fact completed the first step of this conversation, which was to build rapport with Josh. And as you can see, the coach now told us that we're going to be able to start talking about the pros and cons, which is the second item on our conversation checklist, and the things that we are going to address with him. So here we've shown you a brief snippet of the conversation, that first step where you are just building rapport with the patient, and you will then go through the whole brief intervention process and discussing pros and cons and barriers to changing his behavior, setting goals with Josh, and so on and so forth. So at this point, I'd like to go back to our slides and talk with you a little more about the simulation. So you just saw the conversation with Josh in a hospital ED, and his screening results showed high risk or weekly use of alcohol. You'll also have a chance to speak with Emily in a school setting where she was referred by her teacher due to decreased attention. And her screening results show high risk or weekly use of marijuana. So here, a great opportunity to practice this very frequent conversation for school-based workers in having that conversation about marijuana with an adolescent. And finally, in the third conversation, learners will be able to assess their skills in conducting screening and brief intervention by speaking with Kayla. Now, Kayla presents in primary care for her annual well visit. There is no acute condition that we can relate to her substance use, and we're really going to have to work with her to start disclosing her substance use and kind of explore the negative consequences of her alcohol use with Kayla. And in this conversation, we take off the training wheels. There is no undo button, no meter, no inner thoughts. And learners will receive a score at the end, which will be broken down between how well they stuck to the conversation checklist and how well they use the motivational style in speaking with the patient. And they will receive feedback and scoring in the form of the dashboard that you can see on your screen, where they receive a score on their overall performance, their use of a motivational style, and how well they engaged Kayla. And below that, they'll be able to see a full breakdown of the conversation and how well they did in each step. So here again, you can see the various steps of the conversation, or some of the steps in the conversation, building rapport, eliciting pros and cons, providing feedback to the patient, assessing their readiness, using a readiness ruler. So students here are really able to see what they did well or not well, and we really designed this dashboard to provide gentle feedback to learners. We don't want to make them feel penalized by this feedback. We want to encourage them to go back and explore those areas where there's room for improvement. And assessment has really been a challenge in this field. There is a quick move towards implementing substance use competencies in health professions, as we've talked about, and the project that we're engaged in aims to do just that. Competency-based assessments are also becoming more widespread. In other words, it's no longer going to be enough to click through a PowerPoint in order to demonstrate that you have mastered certain skills. These kinds of situational tasks, like we just showed you, are going to be more and more important. These assessments are often subjective. When we do live assessment of screening and brief intervention competencies, for example, with standardized patients, that is very limited and doesn't scale. It is subject to each individual rater of the conversation. And there is a lack of standard observation tools. And finally, standardized patients and role plays are very logistically difficult and expensive to organize. These role plays can also make students uncomfortable, and they will obsess with saying the right thing instead of really practicing and engaging in a conversation where they can learn through trial and error what is effective or ineffective. And so we wanted to provide an assessment solution to SBI implementers. And we created SBI Skills Assessment, where we aim to teach learners to screen patients using the NIAAA single question as well as the audit, and to interpret those screening results to identify risky use, conduct a brief intervention, again using an evidence-based model and motivational interviewing techniques to better engage patients. In this simulation, you will speak with Sam, who is a pastoral counselor, and your goal will be to use validated questions to screen Sam for his substance use. And you will then speak with Jessica, who is a physical therapist, showing a pretty high score on her audit screening form, and your goal is to conduct a brief intervention with her to motivate her to lower her substance use. Learners will also have access to a printable intervention card, which they can access throughout their conversation with the virtual patient, and they can also print this and using in their daily practice with real patients. And they will receive feedback on their performance, again, through a dashboard that is consistent with the other one you saw, where they receive a score on their core performance, their use of a motivational style, and they will see a full breakdown of the conversation competencies and just how well they did in each of them. Just to talk a little bit about the impact of these simulations so far, SBI with Adolescents is being deployed to 60 schools of nursing and social work through the NORC and Hilton initiative. And a randomized control trial is underway to evaluate the effectiveness of this simulation. In addition, both simulations we showed you are being implemented by SAMHSA SBIRT grantees, which are schools of health professions, including many different kinds of departments: nursing, social work, pharmacy, physician assistant, psychology, and so on and so forth, as well as implementers in primary care networks, hospitals, and professional associations. And finally, we want to really help our clients support research and development. We can collect survey data, we can collect survey data, excuse me, and provide you with access to that data, including scores and simulation data, which in turn we then use to make continuous improvements to the simulations that you saw. And with that, I would like to open the floor for questions. So if you have any questions, please go ahead, and Maria is going to tell you how to do just that.
Thank you so much, Cyril, for your wonderful presentation. Like Cyril said, and as I mentioned earlier, on the right-hand side of your screen, you're going to see an interface where you can submit your questions. And we will now begin the Q&A portion of the webinar. So, Cyril, the first question for you is: the assessment mode, are there any free response options, or is it always multiple choice between right and wrong?
Okay, yeah, so if I interpret the question, I think it's about whether we give the option to have open-ended statements, or whether we always constrain those choices. It's the latter. We have found that, especially for novice learners, being able to formulate their own reflections, formulate their own affirmations to the patient can be very, very difficult. And so this, constraining those choices into a set of effective or neutral or ineffective techniques really helps put the learners at ease and help them start to identify what might be a positive or negative thing to say to the patient before they start thinking about how to formulate it themselves.
Thank you so much. The next question is: healthcare new for Kognito? Is this the first product you've done for healthcare professionals?
No, in fact, this simulation really builds on a lot of work that we've been doing in terms of screening and brief intervention for a variety of conditions. We have developed at-risk in primary care and at-risk in ED, which are two simulations that help professionals in those fields conduct brief interventions and then screening for both mental health and substance use, as well as suicidal ideation. And we have also developed with the American Academy of Pediatrics a simulation called Change Talk, which allows pediatricians to talk to families about childhood obesity.
Thank you very much, Cheryl. The next question is: what scales did you use for the scoring for the simulation?
So the scoring structure is based on the brief negotiated interview model and the observation tools that are provided with that. The brief negotiated interview is a model developed out of Boston University and Yale University, and which is a very predominant model being implemented in SBIRT and screening and brief intervention.
These are some wonderful questions coming in. The next question for you, Cyril, is, has this tool been tested in medical students and or physicians?
So medical students and physicians were definitely part of the user pool that we tested the simulation with. Throughout the development process, we consulted not only with experts and associations and our partners, but they also helped us identify faculty, students, and practitioners who would be likely to use this simulation. So we have received a lot of feedback from those professionals. In addition, we are, as I mentioned, currently running, or NORC rather, is currently running a randomized control trial, which includes health profession students from a wide range of fields. And so we're very confident that we will see the same results we would expect with any other professionals here.
Thank you very much. Cyril, are there CME credits available with the simulation?
Yes, right now continuing nursing education credits are available, and we also have applications pending for CME credits for physicians, as well as continuing education credits for social workers.
Great. Another question that we have from one of our audience members is the simulation available for use now?
Absolutely. Yeah, these simulations are available, and I invite you to get in touch with me at the address you can see on your screen if you have any questions about implementing or pricing, and I'll be happy to give you a quote.
And a couple of people have asked this question: is there funding available for this or any other SBIRT programs out there right now?
Yeah, that's a great question. Schools often struggle to implement these competencies in their curricula, and there is a lot of funding out there that is available through HRSA, through SAMHSA, as well as other organizations and foundations that are promoting the expansion of this practice. So again, if you have any questions about the funding available out there for implementation of screening and brief intervention or training for screening and brief intervention, please don't hesitate to get in touch.
Thank you so much. Cyril, about how long does it take to complete the simulation, and does the time it takes depend on how much your skills, your skill sets, and so forth?
Yeah, so the length of the simulations really largely rests on your ability to conduct those conversations. Some experts tell us that a brief intervention can be conducted in less than 10 minutes if done effectively. And so we build these conversations to reflect that. Our practice conversations are typically around 10 to 20 minutes, and the assessment conversations can go up to 25 minutes. So the total length of SBI with adolescents is about an hour to an hour and a quarter, and the SBI skills assessment is a slightly shorter experience and takes about 30 minutes to complete.
I know you covered a little bit of this in your presentation, but a lot of people are interested in knowing more about the pros and cons of using the simulation versus face-to-face training.
Yeah, that's a great question. We hear from many screening and brief intervention implementers that face-to-face training can be difficult to organize, can be expensive. I've heard about costs upwards of $5,000 per day to hire an actor and retain them and train them to behave like a patient. So there is a cost and logistics factor. I think the comfort for students is also very, very important. Stress is the #1 enemy of learning. A student who is role-playing in front of their peers and an instructor can feel very uncomfortable, and there's a lot of research to show that. So having a risk-free virtual environment where students can practice in their own time and that they can also access over time. This is not a one-time experience. Typically, they would keep access to it for a whole year through their license. So they would be free to go in and practice at any time they want, which, again, would be very difficult in a face-to-face condition.
Again, a lot of people are asking if we're sending a copy of the presentation slides and the recording, and we definitely will be sending that to you later this afternoon, okay? The next question, how beneficial is it if only one person on the team is interested while other colleagues are not open or hesitant or resistant?
Yeah, again, we see a lot of resistance from some practitioners who complain about that lack of training or time or treatment resources. I think that having anybody ready to have these conversations in any setting is beneficial. It will not cause harm. We also see a lot of, for example, medical professionals deferring some of those responsibilities. If the physician doesn't have time to conduct the screening and brief intervention, they may ask a colleague to screen the patients, and then the physician will conduct the brief intervention. So we see different models being implemented like that. Overall, I would say that the more people in your practice are trained to have these conversations, the more capacity you have built to address substance use with your patients.
Thank you very much. Again, we're going to wrap the session up for today, as we're short on time, but we do welcome you. If you have any questions that were unanswered, please reach out to Cyril directly. His contact information is up on the screen, and you will receive a follow-up email with all of the information covered today, including the slides and the recording. With that, I want to thank you for joining us today, and Cyril for a wonderful presentation. We'll see you next time.
Thank you, Maria. Thank you, everyone, for attending. It was a pleasure to have you, and reach out to us if you have any questions.
We'll see you next time.